Thank you for this, coming to us for this operation. I want you to share your experience because people come from Europe, from African countries, it's easier, but from United States it's difficult, more long distance. Where you come from?
To be honest, it's not as difficult as it seems. I came from the east coast of Florida. So about an 11-hour flight with just from the east coast of Florida through JFK. And then about a 2-hour flight to the transfer, just one stopover. So it wasn't, the flight is the most difficult part, to be honest with you.
The flight is the most difficult.
That's the most difficult part.
I think so.
Yeah. So experience all around, very good. I was nervous about it at first.
You had the operation in Live Hospital.
Yes.
This is the most expensive but most fancy hospital. Like, what do you think about it?
Excellent. They take very good care of you. They're obviously, overall Turkish people, they're very honest, humble people. So it's easy to get around and to, one of the things is I came by myself, and you and I discussed this.
Yes.
So coming by yourself is a question, right, that people are not really comfortable with, going under general anesthesia.
Is it difficult when you wake up, at first night you stay at the hospital and you are alone? How is it?
It was pretty easy. The only concern that people have is obviously they go under general anesthesia, they're here by themselves. Yeah. So it's a very vulnerable state of being. But the people here are great, and the hospital took very good care of me. The hospital is top notch.
One more question. You had a secondary varicocele, that is recurrent varicocele. You had a previous.
It's not recurrent. It was never fixed. As you say.
Yes, it is. We call it persistent varicocele.
Persistent. Yes, this is more accurate.
So you operated 10 years before?
10 years before with microsurgical subingual.
You what was your age at that time?
27.
27. Yeah. So how did you understand you had this persistence, and why did you decide to come here?
Well, the vein at the bottom of the testicle never went away.
Yeah.
So it shrank, and my urologist back in the U.S. said it'll go away, but it never did. And the thing with data that people read about and things like that is that all my parameters increased. Testosterone increased, sperm motility increased, sperm count increased. So we said the problem is finished.
Yes.
But then 10 years later, my veins your veins don't get better with age, right? So then now the sperm is not that good. Yeah. And now that I'm trying to have kids, this is obviously a problem. So I think the only way to do it is to deliver the testis and remove any remaining veins.
Really, to be honest, in 70% of the patients, even without delivery, even with conventional procedure, it heals completely, 100%. If you are in this lucky 70% portion, you would be healed. But 30% is not severe. So the classic operation is even successful for external veins and varicocelar veins in 70% of the patients. I have to say that. That's why people are not searching for a better solution. They say, okay, most of the results are good, and they don't care, they don't look for another solution. But 30%, you are in the unlucky 30% portion.
But this is the reason why data is a little skewed, because when you do the grading of varicoceles, it's grade 1, grade 2, grade 3, but then grade 3 can have multiple issues within, right?
Yes.
So if you're 70%, only the internal spermatic veins are involved,
yes,
and then everything else is okay, but if the unlucky 30% needs additional.
Yeah, that's correct, and actually you cannot understand which one will respond, which one will not respond. I can understand before the operation with ultrasonography who will respond to embolization, who will not. But with conventional operation, I cannot say you will be better, you will not be better. But if there are too much big veins in the scrotum, like bag of worms, it's more difficult to have a complete response with the conventional procedure. But you will never know. 70% of the patients are healing with this. So secondary operations are always more difficult to heal. How did you feel comparing to first one?
Very similar. I was nervous about the delivery of the testicle out of the body. I think that's something that surgeons in general are nervous about because there's more trauma. But to be honest with you, it was pretty easy. I don't feel, to be perfectly honest, if I think back of the first surgery was more painful afterwards because since they only clip certain veins in the external spermatic vein, when the blood vessel becomes diseased, it hardens and it feels very, it actually hurts. There's this weird pain.
Are you an engineer?
Yeah.
Yeah. This is obvious.
there is this weird feeling of the blood vessel dying.
Yeah.
So that actually hurts for like 3 months, right?
Yeah.
Versus now, since you took it all out, it's immediate. There's no pain at all.
You really understand this process very well, but if people didn't understand, I will try to explain one more time with my bad English. But as you say, when they ligate, the vein is still there and it fills with blood and it makes stretching. And sometimes it is more painful. The patients double the varicocele because it was not flowing. Now it's not flowing, completely obstructed. So there is sometimes really irritation and discomfort after the procedure.
Yeah.
But when we remove it, it's finished.
Exactly.
Finished.
And that's something that you would only know as a patient because. And then the other thing is there's complications with this procedure too. If you have this subinguinal, sometimes you can clip a vein that goes to the penis. Yeah. So that can also be a secondary thrombosis type of complication, things like that. In this case, it was easier, to be honest with you.
Yeah. So I see inside, okay, the external vein was there, gubernacular vein was there. They remained not resolved, not absorbed, but internal veins was perfect. To be honest, they did a great job. Usually in United States, they really very nicely operate. They are very careful. They make detailed operations, and all the veins are ligated or clipped. I think we counted maybe 3 clips inside. Yeah. So other than this, they also ligated 2 or 3 vessels. I can see the silk ligations. They are not melting, not absorbed by the body. They are still there. And the remaining veins through the testicular side, they were, some of them was alive, still alive, but they were thin, not too big. But normally, urology associations, neurology society thinks that they will die, fade away, and will disappear. No, they are not disappearing.
They don't disappear.
Yeah, they were still there, but thin. They would not be a problem if the external vein and the gubernacular vein was disappeared. But they were alive, so the blood circulation continued, and this is why you had this problem.
Yeah, the other problem that you mentioned in one of your other videos is that there's contralateral connections to the blood vessel, right? Yeah. So even if you clip it upstream, you might still have the circuit. So I think you mentioned that,
like 5 veins. If there are 5 veins, and you clip one, and you said, okay, these are very tiny, don't touch to them. There are too much in between conjunctions. So the blood will come here. Okay, this is obstructed, and it go here, and bypass this part, and the blood flow will continue in this large vein, and the large vein will not disappear because there are detours, bypasses.
Yeah.
So I don't blame the thin veins. Thin veins may remain there. They will drain the testicle, no problem. But thick veins, they are very large, and the blood flow is slow, and they are heating the testicle.
Yeah.
So for me, when you remove the large vein, even you don't touch to these tiny little veins, the problem will be fixed. But you have to remove the large vein. But what I'm doing now, as it is recommended in our conventional surgeries, we have to remove or ligate all the veins. So I am taking out the big ones and ligating the small ones. And I wait. If I see an enlargement in the testicular part of this vein, I ligate it there again. I wait if there is enlargement. So my procedures actually takes like 45 minutes, a little longer than normal one. But we are happy. When I looked with Doppler now, it's all finished immediately.
Yeah.
We don't have to wait for the remaining veins to disappear. This is good. You have some ödema, no problem. So you feel yourself good? What do you say?
I feel excellent. I can walk perfectly fine.
Even you had another operation after our procedure. Tell it, please.
Oh yeah, you know, if you're Turkey, Istanbul is the mecca of medical procedures. So I give myself a little touch-up in the hair. So, but no, overall pretty happy. Very happy with excellent food as well.
Yes.
So the trip was.
It's
The
like
most difficult part.
Mexico. Yeah, the food is in Mexico. We call it Mexico. It's very nice, and Turkey also. I sometimes think people have to travel to Turkey just for eating. Just you can eat for very cheap, just for buying some, making some how do you call it? Taking some gifts, some stuff. It's cheap. Everything is cheap and tasty. Just this is a reason for tourism.
Yeah, absolutely. So, if anybody has questions, you know, believe it or not, there's Reddit groups asking about you specifically.
Really?
Oh yeah, yeah. People have suffer from these specific conditions, and as a patient, you would know what is the affliction specifically. And when it comes to this particular case of the 30% of having external spermatic veins that don't go away, that will heat up the testicle. If they're big enough, it will heat up the testicle. It will affect your sperm morphology specifically. In my case, very clearly. So it will give problems, you know, especially when you try to have kids and things like that. And a lot of doctors will say, well, you know, even if your morphology is very poor, if your sperm count is okay, you will have no problems. This is not true. You will have problems. So I think if anybody's nervous about coming to Istanbul, I don't think there's anything to be nervous about. This was my first time, and the experience was excellent. Everybody very nice, kind, honest,
Thank you for
fair.
sharing. Thank you for sharing this, because it's important. People, of course, hesitate, but we had many people, even from Korea, and nobody from Japan yet, but still, even from Korea, every part of the world. It's possible. It's doable. I am used to manage people with this overseas treatment, and we talk from WhatsApp before the operation and after the procedure. On the follow-up, we will talk, we will be in touch. And this operation is not something that you need very close attention for 2 months. No. That's just after the operation. Now it's 4th day. No.
Yeah, I came.
3rd day.
It's 3rd day after. I honestly barely have any pain. I'm only taking an ibuprofen twice a day. That's pretty standard. I can walk fine. I'm ready for my flight tomorrow, so I'm very happy that I came.
So tomorrow is Saturday?
Tomorrow is Saturday.
You come here on Sunday, right?
I flew out on Saturday, and I arrived here on Sunday because you lose 7 hours.
Okay.
But tomorrow, I arrived the same day.
Yeah,
it's pretty easy.
This is good, and you had the operation on Tuesday because this luxurious hospital has need 1 more day for preparation. They are a little
which is great actually. It made me feel way more comfortable because they wanted to know, you know, they don't have my medical history, right? And then if you have any, in my case it's easy because I don't have any allergies to anesthetics or anything like that. But if you do, they will go through all of that. And they will test you to see if you have any diseases, to see if you have anything, and everything is done on the spot. It's very efficient. Coming from the US, I can tell you this is something that is atypical because in the US, if you have to have something like that, you have to get labs first a week before. Because the hospital won't do the labs, unless you go to the emergency room, then they do the labs there. But when it comes to operations, you have to do a lot of prep. Weeks before. That's why people.
This is an unnecessary delay.
It's inefficient, very inefficient. But that's a different topic because healthcare in the U.S. is a little
different.
It's different. It's reigned by the insurance world. Here, it's efficient. Everything is efficient. Like example, you have your ultrasound machine here. This is not the case in the U.S. You go to a urologist, you need a referral. You go to a urologist, an ultrasound place. They do the ultrasound. You wait 3 days. Then they give them the radiology report, and then you meet again, a couple weeks later or a week later. This is inefficient. So in this case, you take it to the machine, you do everything yourself. So you know immediately. You assess it, and you say, this is the problem. It's very efficient. everything here works very efficiently, in my opinion. So I think if you come here for the varicocele surgery, I think 5 days is more than enough.
Yeah, 5 days for
More than enough.
If you want to keep it short, 5 days is enough. But 1 week is safer, especially from coming from the States, Canada, or overseas countries. So
Like fly out Saturday, arrive here Sunday, pre-op Monday. You can even do some sightseeing Monday night, even though you probably will be jet lagged like I was. And then surgery Tuesday, stay overnight at the hospital, hang out Thursday, Friday, fly back Saturday. Easy. And I feel great, just so you know, so I'm very thankful.
Thank you very much for joining us and sharing all these with us. Thank you very much.
Yeah, you bet.